Good day, everyone. Thank you so much for your interest in our poster. I will be presenting today on behalf of Dr. Eric Brown and our team at the University of Miami Perla Lab. Allow me to start by saying that despite the need for youth alcohol, tobacco, and other drug use prevention efforts in Latin America and the Caribbean, we currently observe that the large-scale implementation of such interventions is still lacking. Therefore, we partnered with the Inter-American Drug Abuse Control Commission, the CICAD, of the Organization for American States to conduct a scoping review of prevention interventions that focused on youth alcohol, tobacco, and other drug use in the region. Our scoping review focused on interventions that met these following criteria. They had to be specific to health promotion and prevention, implemented in Latin America and the Caribbean, targeting individuals between 6 and 21 years of age, and focused on youth alcohol, tobacco, or other drug use as a final outcome. We conducted the search in the databases outlined here in the poster using what we call an adaptive search strategy. That means that it could be more or less complex depending on the density of publications for each of these countries. Searches were conducted in English, Spanish, French, and Brazilian Portuguese. We also conducted interviews with prevention experts from Latin America and the Caribbean to complement our findings. These experts were academics, practitioners, and government officials working with prevention in the countries within the region. Participants had the option of answering the questions in an interview format or in a self-administered survey, either in English, Spanish, or Portuguese. Questions focused on intervention content, design, delivery, and documented or expected impacts. So the scoping review led us to identify just under 5,000 publications from 30 countries. But after scanning through them, we realized that only 54 were relevant for this study. These revealed 37 different interventions implemented in 12 different countries within the region. Well, as for the interviews and surveys, we conducted them with 46 different prevention leaders, which yielded 44 different interventions implemented in 29 out of the 30 countries that we studied. Compiling the results from both the scoping review and the interviews, we were able to identify 72 unique youth alcohol, tobacco, and other drug use prevention interventions currently available for use across 29 different Latin America and Caribbean countries. Out of these interventions, about 2/3 were developed locally, while the rest were adapted from other countries, mostly from the US and Europe. Most interventions used either a universal prevention or health promotion approach. The schools were the preferred setting, and about 41 interventions used a pre-test, post-test evaluation, 12 of which had an experimental design and 12 a quasi-experimental design. As you can see through the map here in figure 2, most interventions came from Mexico, Colombia, Brazil, or Chile. And in table 1, you will also identify that most of the articles were produced by researchers in Brazil or Mexico. So what can we conclude from this study? Well, first off, there is a lack of publications about youth alcohol, tobacco, and other drug use prevention interventions in the region, and even fewer evaluations. Most of the information we obtained for this study came from interviews, which highlights the need for better ways to disseminate information about such interventions. These could be journals, which are specialized, conferences, organizations of professionals, or even networks of preventionists. We also identified that it was pretty hard, pretty difficult to assess the efficacy and effectiveness of the interventions, either because the publications did not offer us enough information to make this assessment, or because the information we obtained simply came from interviews, from the contact with intervention developers or people who had the experience working with these interventions. It was also pretty difficult to ascertain if programs, when adapted, were still the same original program, or if they had transformed into something completely different, such as the example with Strengthening Families program, which was very different across all the different countries in which it was implemented. One thing that we can also conclude from our study is that further development of the prevention field in the region should, yes, continue to invest in adapting new interventions for implementation in the region, but it should also focus on improving what already exists, especially considering that at least 2/3 of the intervention were interventions that were developed originally in Latin America and the Caribbean. Our hope is that this project can lay the groundwork for developing an online registry of youth alcohol, tobacco, and other drug use prevention interventions in Latin America and the Caribbean, and that this tool will be useful in assisting academics and decision makers alike in deciding what will be the future of prevention in their countries. With that, I would like to thank you very much for your attention. If you have any questions or would like to continue the discussion, feel free to reach out to me through the email outlined here on the poster. Thank you so much. Enjoy the conference.